This video is going to show nasogastric tube insertion. Prior to the procedure, you need to follow these steps. You will always assess the patient as far as medical history that would contraindicate NG placement, such as oral, nasal, throat, esophageal, or abdominal surgeries. You will assess the patency of the nares, and you will do a focused GI assessment. Preparing your equipment needs to be done. All the equipment you will need is shown here. You will cut 4 pieces of tape, approximately 4 inches in length, and place those on a clean surface, such as on the side of the irrigation bin. Don't ever want to place it on the bedside table or on the bed rail. One of the pieces of tape will be split lengthwise, about halfway down. And the other 3 pieces will just be approximately 4 inches. You will apply a pulse oximeter to the patient and assess for respiratory distress throughout the procedure. Also, make sure you encourage the patient to raise their hand at any time if they need you to stop during the procedure. As far as the Salem sump goes, for the most part, you're going to be using a 16 French. You're going to first look at the tube, and you're going to plug the end. There will be an adapter that you want to make sure you keep in case you need suction. And then you will take the white end of the tube and you will place it into the tube, and that will plug the tube. You're going to always be careful when you're holding the NG tube that you are not contaminating it in any way. You want to apply some skin prep to the tip of the nose and allow that to dry. That way you'll be all ready to tape it when the procedure is completed. You're going to determine the length of the tube you will insert and mark it with one of your pieces of tape. So you're going to measure from the tip of the nose to the ear, and then from the ear to the xiphoid process. Every patient will be different depending on their body size and length. You will then mark that area with one of your pieces of tape. You're then going to coat the end of the tube with approximately 2 to 3 inches of water-soluble lubricant. For our purposes at the school, we do use a lubricant in a bottle for the mannequins. In the hospital setting, you will use a sterile lubricant similar to this. You want to hand the patient a glass of water with a straw, as long as that's not contraindicated, and a tissue. Keep an emesis basin in reach. You may need an assistant to help you, and if so, you'll want to have someone set up ahead of time. While the patient's head is tilted back, you will gently insert the tube into the appropriate nostril in a back and downward direction. Rotate the tube if it meets resistance, and do not ever use force. Once the tube reaches the back of the throat, the patient may begin to gag. You want the patient to flex their head forward and begin taking sips of water from the straw. If the patient is not able to sip water, having them perform dry swallows instead is appropriate. Continue advancing the tube to the previously measured length with each swallow the patient takes. If the patient will continue to cough or choke at this point or show signs of respiratory distress, you would stop advancing the tube, pull back, and then attempt reinsertion. You want to check the position of the tube while you're holding it in place in the back of the throat with a pen light to assure that it hasn't coiled into the mouth or the throat. And once you've assured that, you want to temporarily secure the tube with the split piece of tape. You're gonna place the unsplit portion over the bridge of the patient's nose, and you're going to then wrap the split ends under the tubing up and over onto the nose. Be careful not to pull the tube too lightly against the nose. You do need to maintain its position at all times and not let go of the tube until it is secured. You're then going to attach a 60 milliliter catheter tipped syringe to the end of the tube. That comes in the irrigation kit. You will pull back on the syringe to aspirate a small amount of gastric content from the stomach. You will watch the tube until you're able to see the gastric content. Once that placement is verified, you'll push the gastric content back into the stomach. You will then clamp off the tubing with your hands so as not to leak secretions, and you will plug the end of the tube. You also need to visualize and document the number of the NG tube at the near. And a X-ray, which would be an abdominal X-ray at Firelands, will need to be obtained prior to placing anything down the tube. Place the third piece of tape horizontally across the bridge of the nose to maintain a secure placement of the tube. With the final piece of tape, you want to secure the tubing to the patient's gown. You can either utilize tape and or a safety pin. You want to make sure you're putting the patient's head back and forth so that they do have enough room to move without pulling on the tube. If a Salem sump is used, which is what we're using, you want to secure the blue pigtail vent above the level of the patient's stomach, and a good way to do that is by tucking it under the edge of the pillow. You want to make sure you provide oral hygiene every 2 to 4 hours and lubricate the lips generously. Clean the patient's nares and oral cavity as needed. And we are done with this procedure. Following the procedure, you want to do the following steps. And this completes the procedure. Thank you.